Snoring in children is definitely not just some funny, bedtime quirk. It can be a sign of sleep disordered breathing. And new research shows it can quietly affect the way your kids think, behave, and even handle stress. And, the reality is something as simple as a noisy night's sleep could make school, mood, and memory very difficult for your child. A major study published in Sleep Medicine Review looked at dozens of reports on children with sleep disordered breathing. And these researchers found consistent deficits in nearly every area of cognition: attention, memory, language, and even IQ. And here's the surprising part. These issues didn't just show up in kids who had full-blown sleep apnea. These were just kids who snored. So we're not talking about severe medical cases here. We're talking about common nightly snoring, something that could quietly be chipping away at your child's mental sharpness over months and years. Imagine your child's brain is like an iPhone. So you charge the iPhone, you plug the iPhone in at nighttime, you wake up, you would anticipate that it would be 100% when you wake up. But let's suppose you wake up and your iPhone is at 70%. Would you not be alarmed at that? Would you not question it? And then would you not do something about it? Why would we not be as outraged and concerned about our child's sleep habits and their brain restoration and function? Sometimes it baffles me. We worry more, I think, sometimes about what we put in our car, the type of gasoline, than we do what we put in our kids. First of all, the kind of food that we feed them, and secondly, the sleep quality that they get. And the second piece of this puzzle is what's happening inside the body. The 2022 meta-analysis looked at levels of urinary catecholamines. These are stress hormones like adrenaline, noradrenaline. Kids with sleep disordered breathing had significantly higher levels of these hormones, even while they were asleep. And that means their bodies were in a constant fight or flight mode when they should actually be in rest and repair. And that chronic activation can absolutely disrupt deep sleep, interfere with memory, and make emotional regulation far more difficult for your child. So when a child wakes up cranky, when they wake up unfocused, it may not be attitude that they're giving you. It may just be biology. It could just be physiology, true physiological effects of sleep disordered breathing that you're witnessing right before your eyes. It's like trying to fill a water tank that has a hole in it. They're sleeping, but they're not restoring. Another recent study explored the sleep disordered breathing relates to ADHD-like symptoms and brainwave patterns in kids. Now, hear me correctly, ADHD-like symptoms. And children who snored or had breathing interruptions were rated as more inattentive, more hyperactive than their peers. And that study looked at EEG patterns. There's a thing called theta to beta ratio. It's a brainwave pattern type measurement, often higher in kids with attention difficulties. Kids with moderate to severe sleep apnea did not show the normal overnight decline in that ratio, meaning their brains were not calming down, they were not resetting properly. Lower nighttime oxygen levels also correlated with worse hyperactivity scores. These kids are not just acting out. Their brains are literally struggling to self-regulate because they never get that neural rest that deep sleep provides. A 2025 study looked at children who snore but do not have sleep apnea. Researchers found worse snoring symptoms and lower quality of life predicted poorer executive function. Even after adjusting for age, ADHD, and weight, these kids also performed worse on no-go tasks, which measure impulse control. Even just mild snoring can make your child more impulsive, more distractible, less able to plan or regulate behavior. And those are the same skills that shape how a child performs, not only in school, but in relationships. Now, not every child who snores is going to struggle. Some seem to be more resilient than others. Factors like body weight, duration of snoring, timing during brain development may play a role. But across the studies, one thing is consistent: snoring is never completely harmless. It is a warning light on the dashboard. Now, you may drive for a while, but the signal is there for a reason. If your child is snoring regularly, more than a few nights a week, talk to your pediatrician. It could be due to enlarged tonsils, allergies, other causes. Now, I will tell you, you may get the answer back, oh, they'll just grow out of it. Don't worry about it. It's just snoring. It's totally benign. They'll just grow out of it. When, doctor, do you anticipate that they'll grow out of it? And at what cost? I don't like the answer, well, they'll just grow out of it. It is not normal. It is not healthy. And it is not benign. And if they don't grow out of it for 4 or 5 or never, what's the cost of that? And who pays that price? Certainly not the pediatrician. And this is not a criticism of pediatricians. They only know what they've been taught. And this is not an area of expertise for me either. I'm just reporting what I see. But I will tell you that some parents will describe after having treatment, maybe they had their tonsils taken out, maybe they had allergies treated, maybe they had sinus surgery. Any number of things could be the case. Improved focus, improved mood, improved behavior. They describe it as seeing a new version of their child emerge. Calmer, more attentive, and happier. Snoring may seem like a small thing, but it is not. The brain has to have time for maintenance. And when the maintenance gets disrupted, that effect ripples into every part of their life. So the next time you hear that little nightly snore, don't just turn your white noise up a little more so you don't have to hear it. Take it as the body whispering to you something is not right. Something is wrong. At the very least, look into it and don't just take the first answer you get because it might not be the right one.